Yeah, there's a couple of really exciting abstracts being discussed about sarcomatoid renal cell carcinoma in particular. But the one that I will highlight is the one that Dr. Rini will present about the combination of axitinib with pembrolizumab. This combination seems to be very active in all of clear cell kidney cancer, with a complete response rate in the intermediate and poor risk of about 4.8%. In addition, they looked at a subset of those patients with sarcomatoid features, and the complete response rate there, so the sarcomatoid renal cell patients made up about 18% of the total population of patients, but the complete response rate there was pretty impressive at about 11%. And so certainly the sarcomatoid features, we used to think of it as a poor prognostic marker, but they seem to be more responsive to these immunotherapies. In urothelial cancer, there's a couple of abstracts here presented at ASCO that are really, I think, practice-changing and practice-informing. So there is one abstract that will be presented by Dr. Galsky on maintenance pembrolizumab after a good response, stable disease or better, on chemotherapy. And these metastatic urothelial patients really are quite frail and really need more options. He is showing that adding maintenance pembrolizumab to patients after they've completed their chemotherapy will extend their progression-free survival, and I think their overall survival and ultimately. But this is quite practice-changing for what we actually do in the clinic for these metastatic urothelial patients. The other study that is actually a late-breaking abstract, so we don't have access to the data yet, is the enfortumab vedotin update in metastatic urothelial cancer. We saw the early phase 1 data last year at ASCO, and we're about to see the phase 2 being presented this weekend. This trial this treatment is a Nectin-4 binding antibody-directed conjugate. So it gets into the cell via a ligand called Nectin-4, and then in the cell disrupts microtubule production. We've seen some great responses to it in our metastatic urothelial patients, and I hope that it is a therapy that might change our treatment landscape as well for these patients.